Moving on to the hepatitis, which is an adenovirus. It is resistant to lipid solvents, and it can survive. But the key here is what organ does it affect? Liver, obviously HEPA being liver, so hepatitis, but kidneys, eyes, vascular endothelium, um, and can be spread through saliva and feces. So that would be anything, that the saliva or the feces can get onto could potentially spread. So the clinical signs, from the time they're exposed, a little bit, early in the week, later week, fever is going to be one of the main presenting signs, and obviously the younger they are, the more susceptible. But a fever, especially greater than 104, is going to be pretty significant. And fever is very indescript. So can be tachypnic, tachycardic. One also, clinical sign could be anorexia. Anytime something affects the liver and, they're not eating, can have some serous and nasal ocular discharge, some edema, but also could get some corneal opacities where, you can see kind of over, you look at the eye, and really that means, I'm trying to think of the best way to put this. Their eyes don't look clear. They can have like a whitish spot or an opacity that might be seen. On workup, and one thing that's key when we talk about viruses, leukopenia, because obviously our leukocytes primarily fight against viruses. So usually when we see a change in the lymphocytes, you're getting an overall leukopenia, but we're going to definitely look at the lymphocytes, and the increased clotting times. Any reason that you would think clotting times would be affected in hepatitis? Why would I be concerned about clotting times? What is the liver's role in clotting?
The liver is responsible for clotting factors.
Exactly. So anytime, and this goes for any liver issues in animals, whenever we suspect liver disease and, different types of liver disease, one thing we're going to look at are clotting profiles, because, that's going to be a consequence. And that's where the petechia would come in the clinical signs. So if you see petechia and these other signs, it might be pointing to the liver. Now, obviously, you can do a specific testing for this. And obviously, when we talk about necropsy, any lesions on the liver or endothelial changes, which would be that inner lining within the intestine. Again, supportive care. The virus has to run its course, so we're going to do supportive care. IV fluids, potentially a feeding tube, antibiotics, but potentially may need a blood transfusion, because to, give back, we worry about these clotting factors. Now, here's a big one to talk about is parvo, which, if I look at all, the ones I just talked about, probably seen the most parvo cases. I'm trying to think back how many hepatitis or distemper cases have I seen. But parvo is very prevalent, and it causes a hemorrhagic gastroenteritis. And the newer strains have become more virulent, but the virus is ingested. And by day 3 after ingestion, it's going to start to settle in the small intestine. And within 3 to 4 days, that animal is going to begin shedding active virus. Now, part of the issue when you have inflammation in the intestine, and this bottom line says absorption of bacterial endotoxins, the virus damages the intestinal mucosa. When the intestinal mucosa is damaged, then you have, toxins from the bacteria within the intestine can absorb in the bloodstream, which can make, is going to make them more ill. It just kind of compounds the illness. Um, Parvo, very, very specific bloody diarrhea. And now it's not usually completely frank blood. It has this unique kind of grayish color. It's like a tan, a gray, flecks of mucus and blood can be seen. Obviously, they're anorexic, so they're not eating, and then they are vomiting. And especially if litter mates are ill as well. Like if someone says, well, my dog's vomiting and has diarrhea, and then I know two of the litter mates my friends took, and they have the same thing because it's so virulent, so contagious. Definitely pyrexics, they have a fever, they're depressed, and dehydration is going to be the big consequence here. If these guys are not eating, not drinking, and they have vomiting and diarrhea, especially the smaller they are going to start to lose weight and become extremely dehydrated. Specifically, we're looking at the lymphocytes. So if they have a low lymphocyte count and an overall lymphopenia, that is our concern. And that has definitely a poorer prognosis. It's kind of bottoms out their white blood cells, specifically the lymphocytes. And the worse that value is, the worse the prognosis. They can be hypoglycemic due to the fact that they're not eating and vomiting, and then hypokalemic because they're losing potassium and they're not maintaining their hydration. The ELISA test, so the SNAP parvo test, is the most common. You can do a fecal exam to rule out other parasites. They could have both parvo and, or you can isolate the virus via a tissue sample. Let me tell you, just working in ER a fair amount of my career, our policy was if, someone called and then said, my puppy has vomiting and diarrhea, they were not even allowed in the building. It's so contagious. We would go out to the car, we would do a parvo test, we'd go get the sample, which is typically a Q-tip in the rectum. We would take it in the building, run the test, and then if they were positive, we could bring the puppy in through our isolation unit. We would kind of do everything talking to the owner in the car, and that way the dog doesn't come into the building. Now their puppies will get vomiting and diarrhea from parasites, eating things, but you have to rule this out first. And I joke, I've said this to you guys sometimes before, and some of my coworkers know this. I call myself the world's cheapest parvo test. If I go out and I smell the stool and I get very sick, it's one smell that's very distinct and it makes me very ill. So I joke, I said, just send me out there. We don't have to do a parvo test. The treatment, again, it's a virus, so supportive care is going to be key. The more severe they are, as far as the lymphopenia and the dehydration, inpatient, which typically is IV fluids, we check blood work, and we typically will do intravenous, very strong antibiotics. And again, the antibiotics aren't doing anything for the parvo, but because they're prone to the endotoxins and the effect of that bacterial overgrowth, they can get very sick on top of their parvo. Now, I will tell you, unfortunately, inpatient parvo treatment can be anywhere from I would say 1,200 is a very minor case, upwards of $3,000, because if they're going to be in isolation on multiple days, that's repeat CBCs, that's intravenous fluids, that's very high-end intravenous antibiotics, nothing by mouth. So everything is intravenous. And unfortunately, even with inpatient treatment, our doctors used to tell most cases, your dog might have a 50-50 shot all we can do is do the supportive care and hope that their body can fight the virus on their own. Um, we will sometimes also use Serenia, and that's a pretty powerful antiemetic to try and control the vomiting. If there is no vomiting, if they have just diarrhea, I'm going right up to this part here. You can potentially do subcu fluids. We did have some cases where they just could not afford inpatient treatment. What we would do is we would usually give them subcu fluids. Sometimes we'd give them an injection of Serenia, and we had owners that would come daily. We would bring them in through isolation. I would take them into ISO, give them their subcu fluids, maybe give them an injection of an antibiotic, and we would send them home. And we tried to do that for the more minor cases or if we caught them early. But if someone can't afford it, and we had some cases that were successful with that outpatient treatment. So there are some options, but and a lot of client ed is important when dealing with these patients because you have to explain, what we're looking for, how do we know they're in trouble, and then if we do 12 to 24 hours of NPO and there's no vomiting and diarrhea, then we're going to start with a very bland diet, prescription diet, ID, or some enteritis. There's different brands, but definitely extremely bland diet. Start very small. And this goes for any enteritis case. And I always tell clients, start with something bland, and then they get excited because the dog will like scoop up that handful of food. We make like a meatball, and they go, oh, well, he ate that real good, I'll give him a couple more. Well, they've just been very sick, they can overdo it, and then we can start them vomiting again. So I just really impress upon you guys as technicians, don't get lulled like, oh, look how good he ate. You got to start slow. If they held down the water in the meatball, we'd usually repeat like maybe another meatball in a couple hours and just kind of build from there. You need to go really, really slow. I think, and if there's any questions, just pop in. I'm just going to try to keep going through this here. So rabies, which causes an acute viral encephalomyelitis, which is inflammation of the brain. And this is fatal. It's transmitted through a bite. So any bite from, that we have to be cautious of. The incubation period, a little bit longer, can be anywhere from 21 to 80 days, but it can go through the nerves to the brain and the salivary glands. And the signs here, it's going to, there's the prodromal, but I think what most people think about is the furious phase. And then it would advance to the paralytic phase. And when we see them, if you think about a rabid dog and they're drooling and growling and extremely aggressive, twitching, but it's going to eventually, progress to a paralysis. So it can be variable. But now, if I see a dog like this and I look at this picture, I'm kind of freaking out. There's a foamy drool, the eyes, the ocular discharge. You can see how much drool just based on the dog's chest, especially if this dog is aggressive, mouth twitching, ataxic, trembling. Those are all signs because, again, it's affecting the brain, the nerves. You got the saliva, and you just look at them and they're just, now, could I look at this dog and think, oh, did you just have a seizure? But, that's a little bit different. This is excess saliva, this ocular discharge. I think that's a glob that's either a tick or this could be a glob of drool right here. So yeah, I saw that there, but it looks almost like it could be a full tick. or like a chunk of drool. But this is a dog I'm going to be extremely cautious of. The behavior, very excitable, twitchy, aggressive is going to be kind of the key signs here. So any animal that has rabies, so that's just a picture of a dog, is typically going to have some CNS disturbance, which a big thing is change in attitude. Is this an aggressive dog normally, especially if they were a nice dog and now they've become aggressive? And the hypersalivation with the change in attitudes and the snapping and the licking. That's what I was talking about, the mouth twitching and, and very excitable and irritable. It's very like twitchy behavior, a change in their bark. And then the thing that when we get to the later stage, when I said ataxia, because when it gets to the stage where it affects the muscles, the incoordination, disorientation, eventually paralysis. But you're going to see a lot of these other things first before it's going to progress to that later stage. Unfortunately, diagnosis in early stages, the only way that we are going to be able to test for this is they have to be euthanized, the head has to be removed, and the brain tissue is going to be tested. Let's see. That's a good question, JC. They can be pretty out of it. It kind of depends on the stage. The problem is because it's affecting kind of the brains and the nerves, that pain, what am I trying to think of? The pathway is going to be disrupted. Because this is affecting the CNS, it's going to be hard to tell pain from these signs. But unfortunately, the only way to test for this is the euthanasia and have to actually cut off the head and send it into the lab. So it's an unfortunate situation here. So, whoopsie, sorry here. So if for some reason, and I know you guys have done a rabies paper in one of your previous classes a while ago, but if there is a bite from a dog or a cat, usually that animal is monitored for 10 days. There's a 10-day, and if there's no illness in that animal, then we expect them to be rabies clear. So, if it's unvaccinated and it's bitten or exposed to a rabid animal, it can be quarantined for up to 6 months. So the difference here is if they bite, they are watched for 10 days. If they get bitten or we know they're exposed to a rabid animal, and the other thing that we usually ask people is, did you find the animal? Sometimes they can find the animal that bit their animal. And we may, say you wear gloves, you box them up, because sometimes we can send that animal to the lab to be tested. But they may have to go up to a 6-month quarantine. And if there are signs of rabies, anything that's contaminated, obviously these guys are salivating excessively. You have to clean. It's like a 1 to 30 dilution of bleach can inactivate the virus. So it is inactivated by bleach. But, think about, what does the saliva touch? The cage door. I think a lot of people forget about cage doors. They clean the inside of the cage, but the animal licks the front of the cage. They bark, they expel particles. So the cage doors, the bowls, the walls, the floor in front of the cage, all of that would need to be bleached very well. So let me, okay, sorry, that's not what I wanted to do. Here we go. So here's a few of the non-core vaccines. So these aren't, now again, some of these are in, you might get a combo vaccine and they are included, and some are given as a vaccine on the side. Now, coronavirus, even though it isn't considered part of the core, a lot of times it is combined with our vaccine group. Um, but this is the upper 2/3 of the small intestine, the lymph nodes. This is an enteric virus. And, incubation is about 3 to 5 days, but this is spread through feces. Common disinfectants can clean it. Um, Vomiting and diarrhea, although it can tend to be more yellow-green. Like I told you, parvo is a very distinct grayish tan, bloody, foul smelling. So believe it or not, I know all diarrhea is considered foul smelling, but this, is going to have a different one. This can go from an anorexia to depression, although they aren't typically febrile, where with parvo, they typically will be febrile. So, supportive care, and this one's going to be a little bit easier to overcome versus parvo. You could do fluids and electrolyte replacement. I sometimes would tell clients, oh, if they didn't want to do sub-Q fluids, if they just were going to leave, you can try Pedialyte. Some dogs, it's very sweet. They won't always drink it. Leptospirosis. Now, lepto is typically a side vaccine. It's usually not part of the core group or the combo vaccines that we give. But this is a spirochete, spirosis. Here is a few different serovars. But when we tend to call it lepto. This is aerobic gram-negative bacteria, but it is a spiral-shaped spirochete. They do not multiply outside of the host, but it is susceptible to drying, temperature changes. It likes moist soil. The thing is, it can survive up to 180 days. And stagnant water, slight alkaline soil. Now, I don't know about you and your dogs, but if I go for a walk with my dogs, and I live by woods, and sometimes we walk in the woods, I try to stay away from any standing water in low areas, especially if they go try to drink from a puddle, especially, like I said, when we go in the woods and there'll be like a little puddle, of course, they want to go right for the puddle. But this is where, alkaline soil, I just think stagnant water, the edge of like some, neighborhoods have those uh, retention ponds and you've got the water around there. But it is spread the urine of rodents and other infected animals. So if you think about a rodent in the woods or a raccoon and they urinate in this puddle and they shed it, and then your dog goes in the water, the pond water, the standing puddle, drinks that water or licks their paw, and then so it's going to enter through mucous membranes. So if they lick, it could enter through the esophagus, or if they have a cut on their paw and they just step in the puddles, and it is zoonotic to us. So this is why we're so, characteristic. So if they do get exposed, several days of anorexia and dehydration. So they're not eating, they're not drinking, they become dehydrated, they start vomiting, and then they become lethargic. They may start to get painful, all of a sudden maybe they look stiff, or they just look like they're limping. Can get some diarrhea, tend to have a fever, and they can start to get some petechia. When it gets to its advanced stage, because this is going to affect the liver, it can cause liver inflammation, which gives the abdominal pain, and then jaundice. Now, the problem is, let me go backwards. If I look at all these clinical signs, this looks like it could be very many things. And again, clients, and I like to give you guys clinical tips because, when these clients present and, they want the straight up answer, they want the answer now. But all of these signs here, we got to rule out arthritis. We have to rule out, doing a blood chemistry, potentially doing a fecal, looking at a CBC. By the time they get to jaundice and abdominal pain, sometimes that's when they're presenting, because some of this, they're like, oh, maybe my dog got into something. Oh, maybe my dog has the flu. And then they may present finally when we're down to these later stages. Um, but you have to be able to detect the leptospirosis in the specimen. We look for an increase in antibody titers. There is an agglutination test and a fluorescent antibody test. So these are special tests sent into the lab. But this is spread. Let me bring up something. This is going to be shed in their urine. Sometimes these guys, they'll urinate in their cage. They're in our hospital to be worked up. And this happened a couple times when I was in ER. All of a sudden, it was a week later, they're like, this dog is a lepto suspect. Well, now we have to go back through the whole staff and say, who cleaned this dog's cage? I remember a case and I was like, wait, I picked up that blanket and it was soaked with urine. Now, I did wash my hands and I didn't go grab a sandwich after I touched that dog. But when you look back at the case, some of these cases we were working up for like almost a week. And it wasn't until we got to the end of the week that we thought this dog could be leptopositive. And it's zoonotic. So normally we mark the cage, wear gloves. Usually they would want us to even have a mask because, if a dog is soaked with urine and then they shake and then it splashes you, you have to kind of think about all of this when you're dealing. And, unfortunately, I think we get spoiled in veterinary medicine because there's not a lot of things that we worry about that can be spread to us. So I think sometimes we lack kind of good technique, that you wouldn't do if you worked in a human hospital. But if this is on the list of potential diseases, you have to wear gloves. You have to be careful when handling urine-soaked bedding. So IV fluids and either procaine penicillin and tetracycline, their kidneys can be affected. So tetracycline and if the kidney function can handle it, and typically antiemetics. Again, some supportive care, but the antibiotics, this is a bacteria, so it will kill it, but they can be on long-term antibiotics. So this can be vaccinated every 12 months, but it's not a required vaccine. So sometimes it depends on lifestyle and risk. If you own a dog and you live in an apartment building and you literally go to this one little park, or do you, like me, I walk my dogs in the woods. I've got woods on both sides of, I don't live deep in the woods, but I've got woods around me. I know I have raccoons, I have possums, my dogs go by water. I will say, I did give Bo, let me go back. I did give Bo this vaccine. And when he got home about an hour after it, he vomited 5 times after getting the vaccine. I've not revaccinated him. AJ does not have this vaccine currently. I just am kind of careful when I go in the woods. But I think he had a little vaccine reaction to it. And I've heard that sometimes the vaccine can cause vomiting. And again, after he vomited like 5 times in a row, and again, it was an hour after the vaccine, he was fine. So we decided if we were going to give him the vaccine again, we would probably give him Benadryl maybe about an hour before his vaccine for the next vaccine. So again, this is one that a little bit of history, talking to the owner. Do they live by a pond? Do they live by woods? Do they live by, these animals? Do they play in pond water? Then probably worth it to get this vaccine. And Bordetella, which I think everyone, this can be given parenterally, so it can be an injection or intranasal. So there's two kinds, but this is a tracheobronchitis. So really, it's kennel cough. There's lots of respiratory pathogens, but Bordetella bronchoseptica, bronchi, bronchitis. Um, the intranasal is reported to have a better immune response, and this is repeated usually once a year. So that's kind of the current recommendation. It is a gram-negative coxobacillus that lives in the respiratory epithelium. And this is the primary, um, that's the primary causative agent. Now, it can be part of this complex, so part of this Bordetella parainfluenza adenovirus type 2 vaccine. So um, I'm not going to read this whole chart. It's really fuzzy. I don't even know if you can see this. Well, I might try to print this off a little bit better. But let me talk about the spread, because obviously it's aerosolizations, it's respiratory secretions. Now, again, this could be, especially we're really cautious when you take dogs in the kennel, when you guys come in and out of our kennel at school, or if you're working somewhere and then the dogs meet nose to nose, when they've just been, especially if there's a history of they've been in a boarding facility. Because when dogs a lot of times runs sometimes face each other, or they're in, if a dog coughs on their cage and then a dog walks by and licks that cage, they've spread it. So they don't have to cough in each other's face, but obviously that's a key route. But again, human hands, a dog snots on you, you pet the dog next door, you've spread it. Other fomites like the cage door, water bowls, shared toys at like doggy daycare. It tends to stay within the respiratory tract. So your respiratory clinical signs, and it's typically 3 to 10 days after exposure. So the coughing here, and it typically ends with a retch, and the expectoration, which is usually when they cough up something, it usually tends to be like a foamy spit. This doesn't typically have the greenish discharge. It can change to that if we don't get it enough. But in the early stage, it tends to be like a foamy kind of expectorant. And then after the dog has the coughing fit, they're good. When they keep coughing, if we don't treat it, it can go to like a goose honk, or, at the end, it has a very distinct kind of honk. If you do touch the trachea, if you reach in and pinch the trachea, you could elicit what's called a tracheal cough on palpation. If it continues, it can progress to, not eating, fever, lethargy. They're going to get inflammation from all the coughing. And then it can turn to a mucopurulent nasal discharge, and it can advance to a pneumonia if it's not seen. So the history and the physical exam, the radiographs, blood chemistry isn't as significant. And a culture isn't going to be useful because, again, you can pick up a secondary infection, and that may be what you culture. So a lot of this is based on clinical signs. There was a case we saw on, I was working ER. Sometimes I pick up some ER shifts, and it was a yellow lab, and she's like, oh my gosh, my dog just keeps vomiting and keeps vomiting. And it's kind of like this white foamy vomit and with a cough. And at first we thought, when the dog comes back, we're thinking maybe it got something stuck in its throat. When we were watching the dog, it had the very curious, like that honking cough. And I had to call the owner to get the history. And she goes, oh yeah, well, she's been doing this ever since I went to my daughter's house. and visited her and her dog. And I said, oh, and she goes, oh, well, she just got a puppy, and that puppy's 3 months old. And I go, so, and she goes, and then my dog had to stay there for a few days because I went out of town. So her older dog was with a puppy. And then she goes, well, come to think of it, my daughter's puppy is coughing too. Oh, wait a minute. And we realized this dog is vomiting, but it wasn't vomit. It was kind of hacking after it had a coughing fit. And in the history, there was a history of being exposed to a young puppy, and the puppy had a cough as well. So based on all of the clinical signs, and again, the dog was very happy, healthy in between coughing fits. We prescribed a cough suppressant and basically isolation, and that was going to be the treatment. So within the history, when you start digging, especially, oh, I've been around another dog. I was just at the new boarding facility. I was just, boarded at the vet, boarded here. Um, and a lot of dogs, and you guys probably see this when the animals come in from the kennel, is this can be a resident, bacteria, and sometimes they'll break with a kennel cough in a change of environment, like someone adopts a dog or they just come into our kennel. So sometimes the stress and a change of environment can bring this out. So typically, 7 to 14 days, and you can do supportive antibiotics, Clavamox or doxycycline. And then antitussives are cough suppressants. So in not all cases are going to get that, but the problem is, and think about this logically, if I have a dog, what we worry about in kennel cough, is it waking them up at night? Is it interfering with them eating or drinking? When it's interfering with those core, like can't sleep, and I think everybody knows this from yourself. If you have such a cough where you can't eat, you can't sleep, and again, it's going to cause a swelling in the airway. So we want to try to control that cough. So typically an antitussive plus or minus an antibiotic, rest, hydration, is typically going to be a course of action. If you get a vaccine 5 days before the risk, so if you've ever boarded your dog, if you're going to go to a boarding facility, a doggy daycare, a training facility, they really need to have a Bordetella vaccine. My dogs do not have Bordetella currently, but they pretty much are in my house and don't go a lot of places. But if you travel, if you want to go to doggy daycare, they are going to require a Bordetella vaccine. And I know it's said yearly, and I've even heard some people doing it every 6 months. But overcrowding, high density confinement areas are going to lower the risk. It can be cleaned with the basic bleach, chlorhexidine, Rocal solutions. So it can be taken care of. The Lyme vaccine is preventing the tick-borne Lyme's infection, Borrelia burgdorferi. This is not typically a routine vaccine. And this, again, is part of the history. What do you do with your dog? Camping, hunting, going to different parts of the country. If you live on a farm by the woods and your dog is running in the woods, some farm dogs can just, and especially if they've had tick infestations before. This is, again, if I would say 2 lifestyle vaccines, or 3, Bordetella, but Bordetella is more routinely done than either Lyme or Lepto. Lyme and Lepto are ones that it's really kind of either the owner is going to ask for these vaccines because they know their dog has high risk, or you guys taking the history. What does your dog do? Where do you live? With some digging, you might recommend. But again, this isn't recommended for, oh, I live in a high-rise apartment building and I take my dog to this park. Then this isn't typically something that's given routinely. It is a spirochete bacteria, and the ixodes, ticks, are the vector, but usually they have to be at least lodged for 24 to 48 hours to spread this. So some of the clinical signs, and again, this is another disease, Lyme disease. There's a lot of other things that a dog presents with, but shifting leg lameness and muscle aches. It's just an overall ache. They are sensitive. Maybe they cry out when you are just like petting them. When they walk with an overall stiffness. Or now, shifting leg lameness. If a dog has a leg injury from a ruptured cruciate ligament, or maybe arthritis, or they fell on that leg, then it's typically isolated to one limb. But if you've got lameness on multiple legs, that should scream kind of like diffuse issue versus a focal issue. And then overall fatigue, fever, and a lymphadenopathy. Now, an owner may not notice this, but lymphadenopathy is, it's talking about a disease of the lymph nodes, but they're all the lymph nodes, or a good portion of the palpable lymph nodes, are swollen. You should make sure during a physical exam you know how to feel lymph nodes. You have the submandibular, you have the axial, prescapular, popliteal. Inguinal lymph nodes aren't typically very palpable unless they are swollen. It's hard to feel inguinal lymph nodes. A lymph node, a normal lymph node, feels almost like a flat lima bean. So if you have a good animal, you could go home and you could feel your dog. I can find my dog's lymph nodes, the majority of them. Popliteal is caudal to the stifle, right about where the leg bends. And if you reach in the muscle and you kind of strum, and sometimes you feel like this little, anything bigger than that size is, a lymphadenopathy. And speaking as a former oncology tech, lymph nodes can be swollen for a lot of reasons, not just lymphoma, because we have had cases sent to oncology where the owner was said, your dog has lymphoma, and then we aspirated them and the lymph nodes came back reactive, and there was another disease process going on. So I just mentioned that. Can present to kidney disease, and the treatment is doxycycline. So the doxycycline antibiotic for tick-borne illnesses is the common antibiotic. So here's the LymeVax vaccine. Again, it's going to be done yearly. And then, so the doxycycline is the treatment, and obviously, this can be very painful for the patient. And when we give them doxycycline, we're talking about a longer course, maybe a 3 to 4 week course. And then, but again, if they have a history, typically, someone might, and I'm not saying a dog that lives in an apartment and goes to a park can't get this. I never say never. But again, these animals have that history of hiking, camping, being in the woods, knowing that they've seen ticks on their animal before. And, and if someone is going to do that with their dog, talk to them during their exam or when they visit the vet, when they visit your clinic, about checking their dog over and trying to feel for ticks. And again, sometimes it's hard to see. So, do you guys have any questions about those canine vaccines? Let's talk about feline vaccines tomorrow and figure out when we can do a quiz. I'll look at your homework, and again, your parasite stuff should be added into Moodle.